Εξοχότατε κύριε Πρόεδρε της Βουλής των Αντιπροσώπων της Κυπριακής Δημοκρατίας, κύριε Πρόεδρε του Cyprus Forum, εκλεκτοί σύνεδροι, ladies and gentlemen. It is a great pleasure to join you at this first meeting of the Cyprus Forum, albeit not physically present. I would like to begin by congratulating the founder of the Cyprus Forum for launching this initiative to promote sustainable and socially responsible policy making. This time, a year ago, I was preparing to put my vision for the EU's public health policy before the European Parliament. It was a vision built on solidarity, ambition to bring about positive change and health in every sense, from the health of our citizens to the health of our environment, animals, and planet. No one could have predicted that COVID-19 was around the corner, nor that it would test every one of these commitments to the core. As countries rushed to protect their citizens, vital medicines and medical equipment ran out. Supply chains broke down. EU's coordination was desperately needed, but limited by the Treaty of Europe's articles on public health. It took time and restless multi-level efforts for the dust to settle on the initial emergency before European countries began to support each other and work together. For example, by transferring patients and medical teams across borders to relieve overstretched health systems elsewhere. This solidarity has been critical to strengthen Europe's response ever since. Throughout the crisis, the Commission has brought governments, stakeholders, the pharmaceutical industry together to help member states prepare for and respond to the virus. European health ministers have met regularly to exchange views and priorities. At this point, I want really to make a very special mention to the close, fruitful, and continuous cooperation I have since the outbreak of the pandemic with the Cypriot Minister of Health, Konstantinos Ioannou. Very early on, we launched a European team of epidemiologists to develop scientific guidelines for coordinated risk management measures. We have worked very closely with the European Centre for Disease Prevention and Control and the European Medicines Agency to ensure coordinated response across Europe and to accelerate work on new treatments and therapeutics for COVID-19. We established green lanes to ensure goods continued to flow after lockdowns were introduced, and worked with our non-European trade partners to address export bans and ensure continued supply of vital pharmaceuticals. We launched joint procurement initiatives, enabling member states to access personal protective equipment, ventilators, and laboratory supplies, and soon, intensive care medicines. Through the Emergency Support Instrument, the Commission has bought millions of masks for healthcare workers and 30,000 treatment courses so far for remdesivir. These have been distributed on a pro rata basis across Europe, including Cyprus, to ensure equitable access and availability. The Emergency Support Instrument has also enabled transport of medical supplies, of patients and medical teams, as well as training for intensive care professionals and staff to support member states' testing infrastructure. The EU has also adopted a new instrument, SURE, to provide temporary support to member states to mitigate the unemployment risks linked to this crisis. Through this, Cyprus will receive €497 million in loans to finance short-time work schemes and measures to mitigate the socio-economic impact of the crisis. Together, we have overcome tremendous obstacles, but it is essential that we continue working together in a spirit of solidarity as we face more challenges in the coming months. I am very pleased Cyprus has been fully engaged in all of the EU's coordination and cooperation mechanisms from the outset. It has based its policy decisions on the Health Security Committee's scientific recommendations, on common EU guidelines, for example, to ensure adequate testing capacity, and I know that this will continue to be so. However, I also know that my Cypriot compatriots have made a lot of sacrifices over the time. That is why it is so very important to continue our social distancing measures, to wear our masks, to guard personal hygiene, in order not to jeopardize all those efforts until a safe vaccine is developed. I therefore count on your continued support and collaboration to tackle the additional challenges that come with the winter months. A core part of our work in the next few months is securing a safe, effective vaccine universally accessible against COVID-19. The EU's vaccine strategy aims to pool Europe's resources to maximize the chance of success. It enables the EU Commission to negotiate advance purchase agreements with vaccine manufacturers on behalf of the EU member states. It will also allow member states to donate reserved doses to lower income countries elsewhere in the world. No one is safe until everyone is safe. Over the summer months, we have made important progress. The first purchase agreement has been signed with AstraZeneca and the second one with Sanofi. We have completed negotiations with another 4 companies. Our aim is to secure a diversified portfolio in order to increase the chance of finding a safe and effective vaccine. Ladies and gentlemen, I believe that out of crisis comes the opportunity for change. Later this year, the Commission will put forward proposals for a European Union of Health in an ambitious EU for Health programme. This includes giving a larger role to the European Centre of Disease Prevention and Control and the European Medicines Agency so that we can be better prepared to mitigate health threats and pandemics. We will also deliver on Europe's Beating Cancer Plan and a new pharmaceutical strategy by the end of the year. We need more Europe in health and more health in all policies. A few reflections to conclude. COVID-19 is indeed the greatest public health crisis in living memory, and it has exposed both the strengths and the weaknesses of Europe. It has proved what we can achieve when we work together and the importance of a common approach to a common threat. It has shown the courage, the tenacity, and the resilience of our citizens, the importance of sustainable and socially responsible systems to serve each and every person well. As I always say, when the word I becomes we, can only bring about positive results, especially in times of crisis. I welcome the work of the Cyprus Forum. I look forward to hearing your views to deliver this vision, and I thank you for giving me this opportunity to share some thoughts with you. Thank you.